My name is Alexander Asamoah. I work for PHAN Network as the coordinator for the African Caribbean Black Health Promotion Program. I work mainly within the Black community. The idea is to try and help prioritize issues relating to HIV, because in most cases, people do not think so much about HIV. It appears people are not very ready to talk about it. There is HIV stigma. People deny that they are in any way vulnerable or connected to issues relating to HIV. There is a perception that HIV is spread only through sexual issues, and you find many people judging those who live with the virus, blaming them, and showing very negative attitudes towards them. We have known that HIV is transmitted not only through sexual means, but they are all lumped together and blamed. These people don't feel like they belong because most of the time they are blamed. So my program tries as much as possible to bring up the issues that are so related to HIV as a condition that people live with, as a way of reducing HIV stigma that we experience so much here in Peel. I am currently working with a strategy called the It Takes Courage strategy. And the It Takes Courage strategy is trying to encourage and indeed motivate faith community to be part of our fight against HIV stigma in Peel. The strategy aims at bringing faith leaders together, and then there is a training for them. So any faith community member who is interested in the program, there are resources available for you to develop a sermon around HIV. There are challenges actually here in Peel because again there are people who believe that HIV is a Toronto issue. You go to Toronto, but all evidence that HIV is an issue also here in Peel. So I would like to at this stage encourage members of the African Caribbean Black community and who are living with the virus that there is an agency here that is ever ready to provide support and to connect you to the services that are available here in Peel and elsewhere. The HIV in the 1980s, the way we experience it is a little different because there are so many things that are happening. Unfortunately, people seem to be still rooted in the 80s when the disease started. So they move along with still holding on to the stigma and the negative mentalities that they had. But we want to point out that there have been people who initially were very negative towards engaging those who are living with the virus, because we engage them and they have shifted. It is always very important that we have the opportunity to start talking, and anytime I have had that opportunity, people shift from where they were and then they become more optimistic. So we encourage you, feel free to contact us. HIV shouldn't be an issue that we continue to hide. It is something that the community should embrace and talk openly about.